Will Restylane be the best thing right now to help my eyelid asymmetry following Asian bleph? It's been 2 years following my ptosis and combined eyelid surgery on my right eye, and my crease was made too high. My eyelid looks thick and unnatural. I want my fold to be smaller like my normal left eye. Will Restylane injections in the subbrow area help and give a natural result? I don't want more surgery right now, as my wedding is coming up soon, but I want to definitely look into that in the future.
Thank you for your question. You've had ptosis surgery as well as blepharoplasty in the right upper eyelid 2 years ago. And in your question, you expressed that you're concerned about the difference in the eyelid crease as well as the thickening of the eyelid. And you're asking if Restylane will be of any value in trying to create symmetry. And of course, you want to avoid surgery at this time before an important event. So I can certainly give you a perspective as a specialist. I'm a cosmetic oculofacial plastic surgeon specializing in Asian eyelid surgery as well as ptosis surgery, and I've been in practice in Manhattan and Long Island for over 20 years. So I can give you some sense of how I've approached these concerns in my practice. First of all, let's just begin by understanding what was done for your eyelid ptosis, or most likely, since I don't have any other details. When you had your ptosis surgery, an eyelid crease incision was made. Now, this this crease was probably made at a height that was appropriate for the ethnic natural appearance of the crease. The challenge is that when ptosis surgery is done, the skin and muscle of the eyelid above a structure called the tarsus has to be elevated away from that structure. And this is in order to advance or move the muscle called the levator muscle. The levator muscle, like the word elevator, you probably heard the term before. That is the muscle necessary for lifting the eyelid. When that muscle is advanced, the stitches have to be placed between the muscle and the tarsus, the backbone of the eyelid. Now the skin and muscle is then replaced over this area, and it can be stabilized and it can be sutured in order to maintain a certain level of stability so that the skin doesn't slide. But it is not uncommon to have thickening of the tissue in that area when this type of surgery is done in Asian eyelid surgery. Now, the second part where the eyelid crease looks a little bit higher, it can be conjectured that there was some skin removed, or it's just that when this swelling and everything resolved, the crease healed higher. Now, most likely you don't have extra skin, which means that there is no practical way to try to create more of a fold. In order to create the symmetry in your photo that you desire, technically you need some more skin in order to overlap the crease that will allow less of the eyelid plane to be seen. In other words, this platform where typically you apply eyeshadow is a little bit higher on the right side compared to the left. Now, in terms of Restylane, when people have issues with eyelid surgery or Asian eyelid surgery, in our practice we have had some success using hyaluronic acid fillers like Restylane to fill spaces of hollowing in the orbit. In other words, where the bony part of the structure around the eye or the orbital rim, and that space between the bone of the orbit and the crease, we can actually add volume in that area. Now, you have to think about this a little bit as it applies to your situation. When you apply a filler like Restylane to the eyelid skin, you may be adding more weight that is undesirable, and it may make the eyelid feel heavier. So although in our practice we've used this in the orbital area, I don't routinely recommend placing it in the skin to try to lower the crease. Now there are surgical ways to try to lower a crease, but again, I think there's still an absolute amount of skin that you need in order to achieve that outcome. Since surgery is not something you want to do anytime soon, you may want to try just a creative makeup application, things like that, because there is a compromise. When you have a procedure such as ptosis surgery, there are a lot of moving parts, and in terms of the eyelid crease for Asian eyelid, so that you may not. This is something that does happen, and discussing this with the surgeon who performed the surgery is worth pursuing. As far as the thickness is concerned in the soft tissue of the eyelid, we have had some success in using platelet-rich plasma to try to help soften some of the I guess technically scar tissue that's in that plane, to try to soften it up. But again, that's also something that's very difficult to reduce, because you had to put several stitches in order to get the eyelid up, and that space can thicken up. So again, I think it's best that you meet with the original surgeon. Clearly they're an expert in this area, and your eyelid height looks very good, and so I think your overall outcome and result is still what you would like. It's in comparison to the drooping eyelid you had prior. But dealing with these subtleties may be more practical to wait before doing anything else. So I hope that was helpful. I wish you the best of luck, and thank you for your question.